What's up, Hoopers? Do you have pain in your knee when squatting or going down the stairs or sitting for a prolonged period of time? You might be dealing with Patellofemoral Pain Syndrome. So in today's video, we're going to go over all things Patellofemoral Pain Syndrome. Lopez, co-founder of the Basketball Doctors. Our goal for the Basketball Doctors is to improve the way you move and get you playing basketball pain-free. This is all just educational purpose. This information is not medical advice, but if you do have pain, seek out medical attention either from us, send us a DM, or visit your local provider. So let's just jump into the topic for today, which is Patellofemoral Pain Syndrome. So Patellofemoral Pain Syndrome is pretty much just pain around the kneecap or on the patellofemoral joint. So what is the patellofemoral joint? Here's your kneecap, here's your femur, and here's your tibia. In your femur, there's a little groove there. That's where that kneecap kind of sits. So that interaction between the kneecap and that femur, that's the patellofemoral joint. So this patellofemoral joint, sometimes what happens is when there's increased pressure here in the patellofemoral joint, you start having pain there. And what causes this increased pressure or stress? Several things. So one of the things that we commonly see with athletes is they'll have pain going up the stairs or down the stairs, because that involves a lot of knee bending when you're going down the stairs, a lot of force on that quad. And if that patellofemoral joint, or if that quad's not strong enough to hold that, this patellofemoral joint will start giving issues or pain. And when it gives you pain, sometimes it's not just in the kneecap, it may go out to the side. So that IT band syndrome, that's also patellofemoral pain syndrome. So meaning pain around the IT band to the outside. Also, sometimes patellofemoral pain will sometimes go down to the tendon, but it's actually coming from the kneecap joint, the patellofemoral joint. And in rarer cases, it sometimes even goes to the back of the knee. So we have to rule out, if it's something else or if it's patellofemoral, but most of the time it's more patellofemoral. But if you want to learn more about jumper's knee, which is another diagnosis that gets confused with patellofemoral joint, click the link above. We go into more details about jumper's knee. But going back to patellofemoral joint pain, so when you have pain with this situation, you'll probably have pain, like I mentioned before, going down the stairs, going up the stairs, sitting for a prolonged period of time, because when you're sitting, you're compressing that patellofemoral joint, you're bending your knee. So all these little things, even squatting, just day-to-day activities will give you discomfort, because this patellofemoral joint gets involved with anytime you bend your knee or do any movement, this patellofemoral joint gets involved. So another thing that a lot of people kind of say might be a culprit of patellofemoral pain is mobility of the kneecap here. So if you look at this kneecap, the kneecap should move in 4 different directions: up, down, to the outside, to the inside. Some people say that you'll have patellofemoral joint pain because this kneecap tracks too much to the outside. As you can see here in the groove, it fits right in that groove, but sometimes when it goes out to the side a little bit more than usual, it might irritate this groove and cause that patellofemoral pain. So far we track 2 main reasons. One, this increased pressure on that patellofemoral joint. So meaning like we're putting too much stress here on those quads, that's causing increased stress here in that patellofemoral joint. Another one could be that mobility of that kneecap causing that discomfort. Another cause would be, and we'll go into this into a different video, but more hip rotation. So you have too much hip internal or hip external rotation, that's going to cause a little abnormal tracking, back to the tracking of the kneecap joint, which is going to cause that pain in that patellofemoral joint. And the last one is ankle mobility. So if we look at the ankle, so here's your ankle. If you don't have good dorsiflexion range of motion, there's going to have increased stress here in this patellofemoral joint, because the knee has to take more of that stress. So decreased mobility here may be the culprit of patellofemoral joint pain here. So those are some of the main causes of patellofemoral joint pain. And like I mentioned, the symptoms are you're gonna have that diffuse pain around the kneecap and everything. Most of the time, if you have pain in your knee, I would say it's more patellofemoral joint pain. However, the other diagnoses that could be, that we have to rule out are jumper's knee. We also have to rule out a fat pad impingement. We also, for younger kids, Osgood Slaughters. But besides that, and also sometimes meniscus irritation or meniscus issues, but most of the time a lot of people have patellofemoral joint pain. But those are the symptoms, the causes, and in regards to the treatment, like I mentioned, patellofemoral joint pain has a lot of causes, so we got to figure out what's the specific thing that's causing your patellofemoral joint pain. So is it dorsiflexion range of motion? Is it hip stability, hip strength? Or is it quad strength? Or is it just mechanics of your knee? So, or also, mobility of the kneecap. So all these little factors play into a role of treating patellofemoral joint pain. So to quickly summarize, patellofemoral joint pain, you'll probably have pain across your knee joint when you're going down the stairs, going up the stairs, going downhill, sitting for a prolonged period of time, squatting. So if you have symptoms like that, you're probably dealing with patellofemoral joint pain. I hope you guys learned a lot about the patellofemoral joint and the pains associated with it. And if you guys liked the video, hit the like button, hit the subscribe button. And if you guys have any questions, send us a DM on Instagram or send us an email or check out our website, thebasketballdoctors.com. But let's ball for life.